What's going on, guys? XQ420 here. You know what the deal is. You know how I get down when I come around. I'm back. I'm in the building. If you hadn't subscribed to the channel yet, please do so. You won't regret it. You get that day does news and commentary with a twist from your boy. I'm going to jump right into the video. The U.S. confirms first case of the new COVID strain discovered in the U.K. But I'm done with the con job, okay? I mean, I'm just done with it, man. And I'm trying to get this through people's skull, bud. Every time you think that you're going to be able to move past this, they keep making sure that they can find something else to throw out there, okay? Now, supposedly the UK got this super strain, all right? Oh, it's a super strain. It's 70% more transmissible. Oh, man, we know this without a doubt. I mean, how you know? I mean, you know what I'm saying? Now South Africa, they're like, oh, we got the super strain too. Spain, oh man, I think we got the super strain. Or is it maybe because your lockdowns and your mask hadn't worked, so all of a sudden you got to have an excuse for it? And seeing how you're the scientist, you can just come up with whatever, okay? And everybody's going to believe you. Everybody's going to believe you. Fear rules the masses, okay? That's what rules the masses right now is straight up fear. Fear and propaganda. I mean, that's just all there is to it. But, and there's some scientists out there that are like, hold on a second, what's going on here? We've got Carl Hennigan, a professor of evidence-based medicine at Oxford University, Nuffield Department of Primary Care, has expressed skepticism over the 70% figure. He said, I've been doing this job for 25 years, and I can tell you, you can't establish a quantifiable number in such a short time frame. Now, now he's saying right here, it says that every expert is saying it's too early to draw such an inference. It said, I would want to have very clear evidence rather than we think it's more transmissible so we can see if it is or not. See, spot on. You see, that's the problem, okay? Health experts and epidemiologists, they have been infiltrated. There's a bug in the system, all right? And it ain't the convid, bud. It's straight up scamdemic. It's the scamdemic that's going on right now, man. Bud, you can't just wake up the next morning and just be like, yep, Bo, that thing's 70% more transmissible now, Bo. That's a new strain. Super strain. But we sure the vaccine's going to work against it. Isn't it just odd how all of a sudden there's a super strain out right when the vaccine comes out? And from what they're saying right here, the mutant strain has been circulating since September. What took so damn long? I mean, September, October, November, December. So, you mean 4 months? It took you 4 months to tell everybody. You see what I'm saying? They get the vaccines out, and all of a sudden they're like, oh man. Man, how can we keep people locked down? Super strain, there it is, 70% more infectious. Yeah, lockdown and mask harder. And my man right here says they're fitting the data to the evidence. They see cases rising and they're looking for evidence to explain it. Exactly. That's what I'm trying to tell folks, man. I'm like, dude, every time you think you've reached the end, they're like, no, you're not there yet. I mean, you know what I'm saying? But that's the line drawn right there. No, that's not the finish. That was the old finish line. We got new finish lines for you. You know what I'm saying? I know you were looking at 4K, but it's turned into a 4.25K now. And then when you get to 0.25, well, it turned into a 5K. You just like, but well, I mean, when you gonna let it go? Look, and I'm gonna dive right down here because they found this in the infectious strain, which I don't know how all of a sudden they finding the infectious strain. They ain't been able to figure nothing else out, okay, about how to treat this thing or nothing. Even though there's been plenty of doctors telling you, hey man, you can take this and this, you know, hydroxychloroquine, ivermectin, that's worked well. They had one doctor talking about a breathing treatment, budesonide. He's like, man, that's working well, but no, bud, no, vaccine or bust. We don't want to try to save nobody with with these cheap treatments. Why I want to do something like that? So they see right here where they say that the infected individuals in isolation in Elbert County, about an hour and a half south of Denver. Now, Elbert County. Now, this dude's in his 20s and doesn't have any travel history. How the hell did he get the mutant strain? Can somebody let me know? How'd he get the mutant strain? All right. This is what I'm trying to figure out. Man got no travel history. Okay. Living in Timbuktu out there, Elbert County. I don't know if that's true. I mean, Timbuktu. I mean, maybe there's something out there, man. Somebody around the Denver area. Let me know what Elbert County looks like. I mean, is it flourishing? Let me know. I don't know. But then you're gonna say that he got the mutant strain from Britain. Come on, man. Man, who you think I am? Do you think I'm that stupid? Man, no, bruh. Okay. I mean, I'm done with it, man. I'm just done with it all. They talking about this particular. Look at this. They got VUI 2020 12-0. Man, stop, man. 70% more transmissible. Man, but if it's 70% more transmissible, then we need to. But it's over, man. Okay, it's over, bruh. All right. Y'all already told me this was the most infectious disease ever as far as transmissibility. So if it's 70% more transmissible, it's over, man. Pull your mask off, open the businesses, bruh. Get you some vitamin D, vitamin C, start working out, and hold on, bruh. You know what I'm saying? What else you want me to do? I mean, I don't get it. What else can we do? 70% more? But I mean, that should, man, the whole United States should be bedridden in. Let me know. I'm trying to figure the thing out. Now, I picked this up because, of course, they talk about California. Oh, California overran, and I'll show you actual something from the governor's office in Colorado. You know, they got this soliloquy out here, and look what they say right here. But public health officials are doing a thorough investigation. My ass, man, damn your investigation. And then they say right here, there's a lot we don't know about this new COVID-19 variant. Just like y'all don't know nothing about nothing else, man. Stop coming up to me and telling me you don't know nothing, and we got a vaccine that we jabbing folks with. Shut the f up with that bullshit. That's all I'm saying, man. Stop telling me. And here's what, you know what they got? Wear a mask, stand 6 feet apart when gathering with others, and just be around your immediate household. But good luck, man. You know what I'm saying? Man, if it's 70% more transmissible, this stuff right here ain't been working. Okay? Man, get it through your mind. It ain't been working. That's all there is to it. Okay? And I don't want to hear the nonsense. Oh well, if we didn't do it, the cases will be a whole lot more. Says who? Says who? Says who? Okay? I mean, we don't know because folks locked down. Well, except Sweden. Except those Nordic countries, they ain't wearing no masks. They might be doing a little social distance. Well, I don't know, Sweden. You can go to the bar and eat and all that stuff. Now, they won't out there gathering in you know, by the thousands or nothing, but, I mean, I mean, you would able to go out and eat. You know, go to the gym. I mean, let me know, bud. I'm trying to figure it out. They want to freak about under 16 schools. They did close the other ones, but I think they're back in already. So, I mean, what's the deal? I'm trying to figure it out. Now, back to what I was saying about California. You know, right now, California, they got they the first state in United States to have 2 million infections, 2 million recorded cases. It's like, hold on a second now. I mean, they've been locked down the longest. They've masked up the longest. And I'm talking about, when I'm saying lockdown, I'm talking about complete business destruction lockdown. Like, we don't want anybody to ever reside here ever again lockdown except the elites. That's all we want here. Folks on Beverly Hills and all that, they doing all right. You know what I'm saying? Palm Springs. I don't know Palm Springs out there. I may be in the wrong place. They out there in the desert. You know what I'm saying? So, so I'm trying to figure out how they got so many cases. They're probably going to say they had, the mutant virus hit us. That's what the deal is. No, your lockdowns and stuff don't work, man. All we doing is locking down, wearing the mask. You kicking the can down the road, bud. That's all you doing. That is it. Okay? That's all. Now, they're talking about their hospitals being on the brink of collapse. But they're leaving a few nomenclatures out. You know what I'm saying? They're leaving a few things to the wayside. Ain't telling you. the places that they're talking about is the low income uh, places where the folks go to the hospitals there, which are going to have, as I said, a whole bunch of people who live in probably terrible situations, probably your Section 8 housing and all that stuff, and then a whole lot of illegal immigrants. Let's get right now, okay? I mean, that's just all there is to it. They talk about most of the people they're seeing either on the Medicaid. I think Medicaid is for is government assistance, not the Medicare, if I'm correct on that. And then non-insured, which is probably your illegal immigrants. Okay, so I mean, but the rest of the places, Beverly Hills and stuff. I mean, hey, bud, folks have got time right now to do a little TikTok dance. You know what I'm saying? I seen some staffers, but a whole lot of folks tapping their feet right now. I'm like, why are we doing all this toe tapping? Bud, why don't we call some? Hey, if a hospital's overran, can we get some of the some of the travel nurses in there? Hell, where's the ship at? Trump had parked the ship on both sides of the United States back in March, and folks, man, they turned their nose up at it. Why ain't you asking for the ship back out there, the naval ship? I'm trying to figure the thing out. Now, you know, things can backfire on you because the issue that they're having is that it's not hospital beds. That's not their issue. You see, if you don't look into stuff you don't know, the issue is actually having people there to actually work. And the reason why, you want to know why? Oh, they'll let you know why. Hey, what do you know? School closures. They made the actual place that made this Pharmacy Times letting you know. It said, hey, bud, school closures will be especially challenging for nurse practitioners. 22% will need child care. So boom, there we go. Physician's assistants, 21%. Diagnostic technicians, 19%. And physicians and surgeons, 16%. As well as another 13% of the nursing home and health aides who are single parents helping the elderly with infection control in nursing homes. So there you go. You want to close schools? You know what I'm saying? You want to close businesses? Bo, there are ramifications, man. There are ramifications for everything you do, and people are not looking at that. All they're looking at is COVID, okay? But we're too stupid, and I'm saying it, we're too stupid to realize the big picture of the entire world, man. Okay? That's just all there is to it, bud. I mean, man, I just don't get it, bud. So they having issues finding workers. That's what the issue is. And the Lancet Public Health addresses that these challenges, about these challenges, and find at least one in seven, not several, seven medical workers may have to miss work to care for children aged 3 to 12 years old. So I mean, but if folks are having to be out of work from nurses because they got to take care of kids because they can't send them to daycare, they can't send them to school, and it's like, hey, but hey, that might help you out a little bit having some folks there to treat people. Man, you see, that's why when people tell me, oh man, I care. Oh man, I care about somebody. Bo, you can't even run the hospital correctly, man. What if folk been asleep? Man, I know that this is a rant filled one right here. Because man, it POs me, man. Man, folks have known COVID been around since March, man. And if you're overwhelmed now, it's because you just poor at management. That's just all there is to it. And you're not using all the resources that are out there for you. That is it. That is bottom line. I don't want to hear nothing from nobody else. But we built a $1.4 million field hospital for South Africa. Well, why ain't nobody thought Gavin Newsom? I mean, take a little bit of your time out from sipping wine at the French Laundry and touching butt meat and get out there and get your field hospital right if you that toe up. Get some help out there, some assistance. But I don't see no assistance on the way. Why is that? Let me know. I'm trying to figure out. You're trying to save people, right? I want to make sure that you're trying to save folks. So, man, you see this right here. The most locked down place, probably besides New York, in the entire United States, man, they say it's out of control over there, okay? Everybody's falling out left and right. But everybody's told me that lockdown and mask work. So what's the problem? What is the deal? That's what I'm trying to figure out. And as far as this Colorado case right here, man, don't come to me with this nothing burger, man. And if it's true that it's 70% more infectious, all I can tell you to do is buckle up, get ready, get right, okay? And we need to open up because, Bo, I'm going to tell you right now, if we keep messing around, if you keep messing around with this, then what's going to end up happening is that the once the food supply chain gets disrupted and you go to the store and there ain't no food on the shelves, that's when you're gonna see a mess, okay? Because bud, stuff like that can happen if we if we don't get our head out of the sand and realize there's more to life than just some convid, okay? Both sniffles a couple days, move on. Both some people are gonna struggle with it, some people won't. That's just all there is to it. Some people will be in the middle, as is all diseases. Look, I hate to tell people, but throughout the history of man, um, illnesses affect older people more. That's all there is to it, except the 1918 pandemic, where and it was straight up KO in 28-year-old. But the average age of death was 28. But the young folks were getting KO'd in that because older people had immunity from a past virus. So, I mean, they over here worried about that. Health officials worried about that in Colorado. Maybe they did worried about getting some heat to the folks out there, Colorado residents. Man, somebody done intentionally vandalized the actual the energy company out there in Black Hills. And folk out there freezing to death, bud. I mean, they're gonna have to go out there and chop them some wood. Problem is, they ain't got no heater. So we're gonna build a fire. So man, worry about getting some heat back to the folks out there. They got temperatures expected to dip to 2 degrees. Folk, 3,500 people with no heat. I think that's what they said. Something around 3,500. And my screen messed up. Man, what is this? Hold on a second. Let me see if I can get this right for y'all. Oh boy. Hey, this is what happens when you're doing it live, man. You get bloopers and stuff, man. And I'm fine with that. Hey, I ain't perfect. Ain't nobody perfect. But I think they said, man, stop, man, get out of here. I think they said 3,500 people, but they said it was intentionally vandalized out there. So you see, that's what I'm talking about, man. And yeah, there we go. About 3,500 customers were impacted. So hey, how about worry about getting some heat out there to folks, and stop worrying about some 70% more infectious strain, because I ain't listening to it. So I want to know what y'all's thoughts are in the comment section below. I just think it's kind of odd how all of a sudden infections start going up all over the place, and all of a sudden somebody finds some strain that's more infectious. Yeah, I bet so. So like I said, leave your comments in the comment section below. I hope y'all enjoyed the video. If you did, you know what to do. Like, share, subscribe, click the notification bell so you know when I post in the future. I'll catch you on the next one. Peace out.